just take a deep breath. And she was like, we'll get you there, and it was just, they were amazing. Like, they were truly, truly amazing. Palliative care. So with my primary completely shitting the bed on help with the port, she pretty much told me that, well, I'm going to refer you over to palliative care and you can just talk to them about it. So totally just shoved me off onto somebody else. Not shocking. She's been way less than ideal. So I get to palliative care. It's at the cancer center for my health system, one of the cancer centers for my health system. And so I get there, I go to the room that I'm supposed to on the right floor and all that stuff, and I walk in, and the lady at registration was so nice. And she was like, do you have labels for me? And I was like, no. I said, this is my first time. And I said, I have no idea what I'm doing. And so she was like, okay. She's like, go down to the second floor, go to the desks to the left. And she was like, just tell them who you are and that you have an appointment up here. And she's like, they'll check you and they'll give you labels and then come right back up here. And I was like, okay, that's easy. So I go back downstairs. I was exhausted this day. So like traipsing around the cancer center, which is literally gigantic. I was so exhausted. So I go down to the second floor. I go to the desk, tell them why I'm there. They get me all checked in, give me my labels, and I go right back upstairs. And so I walk in, and then the registration, so I like waved my stickers at her, and she was like, great job. And she was like, I've already got you checked in. And she was like, just give us a few minutes, we'll get you in the back. So there was maybe like 4 other people there waiting for palliative. And I think they may have called like a couple of them before me, but I didn't wait hardly any time at all. So my nurse comes and gets me, and she was so nice. And so we go in the back and we start talking about stuff, and she's like, I've kind of looked through like your medical stuff, and she was like, you have a lot of moving parts. And I was like, I said, and I really need help kind of managing like everything kind of like overall. And she was like, okay. So she's like, so I've looked at stuff, like give me the kind of like lay of the land, like how did you end up coming here? And so it's really hard to try to condense like 39 years of medical problems into like 4 minutes. And so I told her like, the big 5 diagnosis and all the little stuff, that comes with it. And that the port was the biggest issue that I'm having right now. Like everybody thinks it's a good idea, but nobody wants to take responsibility for it. And she was like, and she was so nice, and she was like, but we normally don't do ports. Like your primary does that. I literally burst into tears. Like I was so upset because it's like that is exactly what I was expecting, because everybody keeps telling me my primary is supposed to be able to help me. So I burst into tears, and she was like, oh honey, she's like, I'm not saying that we can't, I'm just saying that that's normally not what we do. And I was like, I know, but I said, and so I told her like that it's been this epic, ridiculous journey of trying to get help and trying to stop them from blowing my veins every week. And that I'm struggling so hard with the dehydration, and oh my gosh. So she's getting me Kleenex, and she's holding my hand, and she's like rubbing my arms, and so we kept talking about stuff and what's going on and where I'm at like with treatments, and that I'm doing IV fluids at the emergency room. I'm getting extra fluids when I have procedures before and after. I'm still having infusions done at the other health system, and I was like, but they're having to stick me like 2, 3, 4, 7 times trying to get IVs in. And I was like, I can't keep doing this. Like, I can't. And I'm getting so car sick going back and forth, which affects my ability to feed. We talked about all the flip tubes and the migraines and all of my, subluxations. And oh my gosh, we talked about all the things. So like, when I started crying with her, I was just done. Like, I was so upset, you know, and I couldn't get it under control. And so, oh, she was just so nice. And so she was like, okay, she was like, let me go talk to the nurse practitioner, and she's like, we're gonna figure out what we need to do, and then she's gonna be in to talk to you, because I was gonna see 3 different people, which is like my full palliative care team. So she leaves, my nurse practitioner comes in, and so she asks some of the same questions, but she asked very pointed questions. She was very monotone. She was very serious. It was very question, answer, question, answer, question, answer. And she was asking about medications that I'm on, and, you know, well, do you realize that this stuff is drying you out? Do you realize that this stuff is drying you out? And I was like, absolutely. But I said, you know, everything's a balance. And I was like, so I'm taking allergy medication every other day to try to keep the rashes under control, so I don't have to have huge amounts of corticosteroids and deltazone to get it under control. And, you know, I'm taking this medication because of complications from the feeding tube, and that's going to dry me out. And then I've got ibuprofen in my system every day because of XYZ, but I can't stop that because I can't take anything else because it shuts down my GI tract. And so, so we talked about all the things. I really couldn't get a good beat on her. Like, I couldn't tell if she was going to be helpful, if she wasn't going to be helpful. So first impressions on her was mixed. So we keep talking about stuff, so I burst into tears again with her. Oh my God, I've never cried so much. I cried so much last week. It was just such a bad week. So I talked to her about all the things, and so yeah, burst out crying with her. And so we keep talking about the stuff, and we were talking about the reclassification of my POTS, and that we're trying for a medication, but at that point I still didn't think that I could get the medication until sometime like 9 months from now. And so we talked about all the things, and she was like, okay, she was like, let me go talk to my head palliative doctor, and she's like, we're gonna figure out what we're gonna do. And she's like, I'll be back, or we'll both be back, or she'll be back. I don't remember what she said. I totally feel Botox like moving in my forehead. So weird. And so she leaves, and so I had like a few minutes to try to like get myself under control. And then my nurse comes back in, and she was like, your head doctor is trying to call a couple of your subspecialties to try to get a little bit more of an idea what you're dealing with. And she's like, we've talked to cardiology, and we need to pull all of your records, because cardiology and neuro-ophthalmology and one other one, they're out of my health system, my regular health system. And so she's like, we need to get all of your records pulled in so we can see all the stuff that you're dealing with cardiology, especially with the reclassification and all of that stuff. So I signed my release form for that. And then she was like, give us a few minutes, you know, and the head doctor's trying to call a couple of your people to ask a few more questions, and then she'll be back in to talk with you. And I was like, okay. So she leaves, and like a few minutes later, my head doctor and my nurse practitioner come in the room. And so she introduced herself, shook my hand, and she was like, and my head doctor, and then my nurse practitioner, she sat on the bed like I was sitting in a chair with my feeding tube bag in the other chair, and then my doctor sat next to me. And she was like, okay, she was like, you really do have a lot of moving parts. And I was like, I do. And I said, I need some help. And she was like, tell me what is going on with your primary. And she was like, I don't understand why she is not helping you with this stuff. So I kind of started from the beginning, that I moved everything from my primary into my health system so that I could have somebody with access to everything that could help me, you know, like umbrella all of my stuff to try to help me navigate it all. And I was like, you know, when I changed over, it was a huge decision. And I said, I changed over, and I made sure before somebody was assigned to me, I said, I need somebody that can really help me with this stuff. And I was like, this stuff is not easy. And I said, and it's a lot of stuff. And I said, can she handle a really complicated person like I am? And of course I was told yes, yes, yes. And I was like, but that answer is no, no, no. And I was like, she has no confidence in her care with me. I said, she has to have 2 other doctors tell her that it's okay before she'll do anything. Like the 2 tiny things that I needed her to do when she said yes to start with, now she's telling me no, that I have to go see like other subspecialties. And I was like, this does not work for me. And I was like, I can't manage all of this on my own. And she goes, you are not supposed to handle all of this on your own. And she was like, she said straight up, she goes, we only handle cancer patients. And she was like, literally 100% of the people that we help are cancer patients. And she's like, but we're going to help you. So I bust out crying with her. And so they're rubbing my back and they're like, we've seen what you have been going through. And she was like, we are so upset on your behalf that you were being pushed off on a doctor after doctor. And I was like, I said, it's so hard when you are hoping for help and you're expecting it from, like your primary, whatever. And I was like, just to be said, go see somebody else, go see somebody else. And I was like, I'm so tired of being pushed off onto other doctors. And they were like, we hear you, we understand what you are going through. And she was like, we have seen all of the stuff, we have seen all of your medications, we have seen all of your diagnoses. And she was like, and we are absolutely here to help. It was so nice. And she goes, I am not familiar with all of your diagnoses. She's like, even your big 5, I'm not totally familiar with. And she's like, so we have reached out to like 3 of your doctors, my big stuff. And she was like, so we've reached out to them for a little bit more clarification on things. And she was like, what I want to do is, and she's like, we've reached out for cardiology to have all the notes sent over. And she was like, so I want to talk to cardiology, I want to talk to GI, I want to talk to your primary. And she's like, I need to make sure that there is not a reason that you are not, that you shouldn't get a port. Like, that there's something wrong with your arteries, with your veins, with your, something like that. She's like, I don't have to have permission from any of them to get you a port, but I need to make sure that there's not a reason that you are not to get a port. And I was like, that totally makes sense to me. And she goes, she was like, tell me your reasoning behind the port. So I told her like my 4 pages worth of stuff, like shoved into like a minute and a half. And I was like, they're blowing veins every week. And I was like, I'm so tired of having, hurt arms and hurt legs and hurt arms and hurt hands. And, when they start talking to you about doing IVs in your legs or doing IVs between your toes because they can't get the rest of your vein, I'm sorry, I'm good. Like, that I'm good. That is ridiculous to me in the healthcare system that we have right now, that is even a possibility. And they just kept shaking their head, and they're like, we literally have no idea why you've gone through so much struggle to get a port. She was like, it's just not that big a deal. And I'm like, and that's my thought behind it. And I said, but it's been horrible. And she was like, it looks like it's been horrible. And she was like, now tell me about the miscommunication between interventional radiology, your primary, and GI. And so I talked about the whole thing that I'd asked about TPN. They got confused. They told my primary something wrong. My primary went to GI. GI was totally confused with what she was asking about. And I was like, but if I'm lucky, like, and I get a port and it's good and it doesn't flip and all of that. And I was like, I could keep it upwards of a decade. And I was like, because of what I'm going through GI wise. And I was like, it's definitely a possibility that I'll have to switch to TPN at some point if my GI tract shuts down. And they were like, absolutely. And she's like, and the fact that you even thought to ask about it was really good because you're trying to future-proof it. And I was like, exactly. And I was like, I don't know what I don't know. And so I said, I didn't know if the port could possibly help me, like in the future if I have to have TPN. And they were like, valid question. And I was like, well, apparently it wasn't, because as soon as I asked that question, the shit hit the fan. Everybody freaked out and they pulled my authorization for the port. And they were like, what do you mean? And I was like, I had authorization for the port. Everything was being scheduled. It was being run through my insurance so that we could actually like pick a day. And they were like, and then your primary pulled it? And I was like, yeah, because I asked a question about TPN. They start shaking their head again. And they were like, and it was something about like a single port or a double port. And I said, well, I really wanted to get a power port so that I have the ability that I can still have like high contrast, like, because it's high velocity, you have to have a certain kind of port for it. And so I asked, so I wanted to have a power port put in. And I said, but with admissions, hospital admissions, and how many tests and procedures that I have to have done, I said, I decided after I talked to interventional radiology that we really should have a double port put in as opposed to just a single, because why the heck not? If I'm going through the process of of getting it and I have to, why wouldn't I get a double port? And they were like, exactly, why wouldn't you get a double port? and just to let you know, for every patient that gets a port through us," and she goes, "everybody gets a double port. We don't do any singles anymore," because she's like, there's no point in getting just a single for what all of you guys have to go through. And she was like, utterly ridiculous. And she was like, and she was like, "I understand you're wanting to protect your veins. I understand that you only want that, like peripheral sticks for when you have to have them at this point." And she was like, "With what you have and what you have gone through and what you are going to continue to go through, because you do not have like a cure possibility for any of your stuff," she was like, "Of course you should have a port." And they just kept shaking their head. And you know how I said that I couldn't get a beat on my nurse practitioner? I didn't know if it was going to be good, bad, if she was going to be like a cheerleader for me or not. And so I'm talking to my doctor, and like I'm talking to the nurse practitioner as well. Yeah, like I wanted to make sure that she was very much involved in the conversation. And she just kept shaking her head. And then she would look at the doctor and she would be like, "Can you imagine that this is what she's been going through? And this is ridiculous." And I mean, she was totally an advocate. Like, it was so amazing. And so I talked to them about everything. And then she asked, my doctor asked, and she was like, "Tell me the bad stuff." She was like, "Tell me the bad stuff that you're worried about with getting a port." And so, like, it almost felt like I was having a test that I didn't study for, which was kind of like, and I was already so emotional, which kicks in my POTS and all the rest of the crap. And I was like, I have to worry about infection. I have to worry about twisting. I have to worry about losing the catheter and it having to be fished out of my system, like through an artery in my leg. I have to worry about stuff getting blood clots, like I just started like listing stuff off that I could think of off the top of my head. And I was like, it's not like this is an easy thing. But I was like, it has to be better than what I'm dealing with now. And she was like, "I couldn't have said it better myself." And she was like, "I absolutely, completely agree with you wanting a port." And she was like, "I have no idea." And I was like, because I said, I'm dealing with the problem with the port exactly like what I'm dealing with when I go to the emergency room for fluid. And she was like, "What do you mean?" And I said, "I go to the emergency room for dehydration. They want to give me one bag of fluid and they want to admit me because they don't want to sign off on my dismissal." And I was like, "I'm too complicated and nobody wants to take responsibility for letting me go because I'm so complicated." And she was like, "I very much understand that." And I said, "So that's exactly what I'm dealing with my port." And I was like, half of my subspecialties, everybody that I've talked to thinks it's a great idea, but nobody wants to put their name on it because they don't want to be responsible for maintaining it. And she was just, they were shaking their head and shaking their head. And they were like, she's like, "I'm so sorry." She's like, "I'm so sorry that you have had to come this far and have this kind of care not to have care." And I was like, "And it's what I feel like." And I said, and they were like, "Why are you still with your primary?" And I was like, "How do I pick a new primary?" And I said, "She was luck of the draw. Anybody else is going to be luck of the draw." And I was like, "I feel like I'm stuck in between a rock and a hard place. Is somebody else that I'm going to get be even worse than this? Can't imagine it at the moment, but I'm sure it's possible." And I'm like, "So what do I do?" And they were like, "You stay with your primary for right now until we get a handle on things." And she was like, "And I will help you find a primary that can actually help you navigate all of this stuff." She was like, "You need more help than what you're getting, and it is ridiculous that you are not." And so that was awesome. And she was like, "And I want to talk to your cardiologist." And I was like, "I need you to understand something about my cardiologist." And so she was like, "Okay." And I was like, "I wasn't worth his time 3 days ago." She was like, "What do you mean?" And I said, 3 days ago, I had a mild form of POTS. And I said, I was not worth his time. He would come in, he would send everybody else to talk to me, and they would give him the Cliff Notes version. He would come in, tell me 20 seconds of what he wanted to tell me, and then he was gone. I had to call him back to ask questions. It was just, it's awful. And I said, but 2 days ago, when I was reclassified as full-on hyperadrenergic POTS, and I said, then all of a sudden, it was all about, oh, Mrs. Spears, please sit down. I can't wait to talk to you about your test results. What questions do you have? We're going to do this, this, and this for you. And here's more prescription for IV fluids and all of this stuff. And I was like, so 3 days ago, I was just as sick as I was 2 days ago, but I wasn't worth his time. And I said 2 days ago, after a year and a half of me telling him that I had this form, he finally believed me because he finally ran the testing for it with all the adrenaline markers and all of that stuff. And I said, so 2 days ago, I was finally worth his time. And I was like, I was so mad. And she was like, they just started shaking their head again. And she was like, and I said, my biggest problem with that is, I said, he is supposed to be the biggest guru of EDS and MCAD and POTS and all of that he knows all the things, and he is supposed to be the end all be all, of all the stuff that we go through, and everybody telling us it's all in our head, or just rest and drink more water and all that crap. And I said, so he's supposed to be that person, but I said, before he ran the specific test that I've literally been telling him about for a year and a half, I was not worth his time. And I was like, I have a big old problem with that. They're shaking their head again. And so I said, so I've already requested to be moved back to cardiology at my health system, my big health system, because I said, I finally have all the information that I need to be taken care of here, as opposed to having to go over there. And they were like, okay. And I said, but my cardiologist doesn't know that yet. And so I said, because I'm still trying to work up the medication and all that. And so I said, so I need to make sure that he doesn't know until I'm actually ready to move over. She was like, I would never discuss that with him. I would never, go against your confidence. And she was like, but thank you so much for telling me that. I very much understand, being kind of stuck in the middle at the moment. And she was like, okay. She was like, give us about a week. She was like, give us a week to get all the records in. Give me a week to kind of get up to speed on everything that you're doing. And she was like, let me make some phone calls and shake things up a bit. And she was like, I don't know exactly what we can do yet, but she's like, I'm sure we can do better than what you have now. So I thanked her profusely and told her how much that I greatly appreciate, them listening and them trying whatever they can do. And she was like, just take a deep breath. And she was like, we'll get you there, and it was just, they were amazing. Like, they were truly, truly amazing. Okay. The difference between palliative care and hospice care. Palliative care is care that you can have immediately upon diagnosis, meaning that you are still having treatments, you are still trying to do everything that you can to feel better, do better, get your body to a better place. Like, these are the people that will get in the trenches with you and fight to get the best, quality of life and whatnot. Hospice care, on the other end of the spectrum, is after you have stopped treatment, that you are completely in the end of life type of transition. They are there to make you comfortable and make the rest of your life as good as possible, but you don't have to be under treatment for that. So that is palliative care. So that is why I'm with palliative care and not with hospice care, because I'm gonna kick this shit in the ass, because holy shit balls, I am too young to have to deal with all of this junk on my own. So anyways, I'm very much crossing my fingers and toes and everything else that I can, that they can come through for me, because I have a lot of things riding on getting a port, and that there are a lot of other subspecialties that are waiting on me getting a port, that we can try some other stuff. So cross my fingers, send me some good thoughts, and I love you guys. Thanks so much for all the awesome comments and messages, and I can't tell you how awesome it is. So alright, give us a like and a thumbs up and all that good stuff, and subscribe below, and I'll see you later. Bye.